So I'll start my presentation by showing you, first of all, introducing the organizations that I'm working for, and slightly recap what has already been said by Andy and by John, because I have some of the points there. And I'll give you an example of what we've done in the EU about healthcare benefits and examples of how the healthcare sector in Europe has been dealing with reducing its climate footprint. So, Healthcare Without Harm is an organization it's an international organization. We have an office in Europe, in the US. They've got members in about 53 countries and about 480 organizations. So the objective is to transform the healthcare sector. You'll understand why I introduced this when you see the type of work we're doing, making sure that the healthcare sector is no longer a harm to humans and the environment. So examples of the work that Healthcare Without Harm does is removing mercury and PVC, etc., from the healthcare sector. That means hospitals, clinics, and also working with doctors and medical professions like nurses and other public health people to raise awareness and help reduce climate change. Health and Environment Alliance, I'll go quickly, is a network, it's a European-based organization with European members larger than European 27, so including the WHO definition of Europe, 53 countries as well. The idea is to work for a better health by influencing policy. And again, we're doing work in different areas, including climate change, reducing waste and toxics. So we've heard already this morning, we heard from Andy, we heard from John, why should we bother? Well, climate change is the biggest threat of the 21st century. And this is one of the reasons why we're working on climate change. And also climate change is a development issue related to sustainable development as well as to the global development context. The latest UNDP Human Development Report, which was published last month in November, showed that by not acting on climate change, environmental degradation, and environmental pollution, we're actually hindering health and income development in especially the so-called developing countries. So we need to do something about climate change. And this session is on health for benefits, so I will concentrate on why it's good to address climate change and look at the health for benefits. So we have here a report that we did. It was a study commissioned looking at 16 EU countries to start with, and then 16 other EU countries to start with, looking at what would happen if the EU, the European Union's climate target right now in its pledges for Copenhagen is 20% emissions reduction. So we're saying, what if it moves 10% higher, just to 30% emissions reduction by 2020? Well, the report shows that would have financial gains, so saving money of up to 30 billion euros per year by 2020. And this is just a 10% increase. If you add the emission reduction target from up to 20%, you have already 52 billion euros savings. So it will be a total combined saving of about 80 billion euros per year by 2020, if we just add on 10% reduction target. And this is why the talks happening here in Durban are very important. However, the EU is still on its position, and like we heard this morning, saying they would move if other developing countries or other big emitters also move. However, we're saying they should move because there are health benefits, there are financial benefits. Now, that amount of money you saw is actually a result of improved reduction in air pollution when you reduce greenhouse gas emissions. And the reduction in air pollution actually creates these health benefits specifically. So you have 140 additional years of life spread out the EU. You would have 13 million fewer days of restricted activity for people who are suffering from respiratory diseases. Reductions in days where people with asthma, etc., are using medication, up to 1.2 million fewer days, and fewer consultations as well as hospital admissions for respiratory and cardiovascular diseases. So there are substantial health benefits to be had by just increasing this emission reduction target just for the EU. Now, well, the EU has not necessarily been on a standstill. We have the European Parliament, which has been actually supporting the idea of a strong climate change target. We have one MEP who is here in Durban, Bas Eickhout. He's a Green Dutch MEP, for those interested. And he's been one of the biggest supporters of the story of health co-benefits. And this story is being told within the discussions about climate change and what the EU should do in Durban. So what the Parliament has told the European Union is that when you go to Durban, what we have to do is ensure we come out of this with a second Kyoto Protocol commitment period. We've heard that's in a stalemate here in Durban. However, from the European Commission perspective at least, this is one of the things they're hoping to achieve. They've also been suggesting to the EU that we should come out of this with a stronger emission reduction target, so the EU should lead by example, move to 30% instead of dilly-dallying on the 20% and waiting for whether China or the US or whatever to start moving. Lead by example. The European Parliament has also been talking about the finance, the Green Climate Fund that we've heard about, literally saying that, listen, we would like as European Parliament to propose to the European Union, when we come to Durban, we should make sure that the $100 billion that was promised is operationalized. So, I mean, just to show you that the EU is not necessarily, yeah, the different parts, different countries are for, different countries are against, but in general, the European Parliament and as well as the European Commissioner for Climate Action has also been very vocal in supporting tougher reductions. However, she can't act alone. The Union acts as one. And she's also been one of the proponents who has been saying, well, reducing climate change can have health co-benefits. So, and as well as that, we have in the European Commission one of the flagship policies, the Roadmap 2050, Low Carbon Roadmap 2050. So this is going to be politic for Europe, so including the UK and all the 27 countries. And one of the things that's highlighted in there is actually health and air quality improvement. And they do talk about health, impacts to health, costs of implementing climate change, the climate change package, and the benefits. So the story of health for benefits has been, we've been lobbying all these people, but also the story has started entering into mainstream European politics. However, it's still not necessarily the policy, because even though we have this paper, the Low Carbon Roadmap to 2050, what's discussed here in Durban is still not necessarily in line with some of this language which exists there. So we still have work to do. Now, I'd just like to show you a few slides of what the healthcare sector in Europe is doing. It's just 3 examples. Some are members of Healthcare Without Harm, some are people from the National Health Services from the UK, like you heard from Andy Haynes. And just to show you what they have done, because we're here as the healthcare sector and we're always saying we need to do something, we need to do something. However, the healthcare sector has started doing something, and it can actually also share this with people here in South Africa, and maybe also steer the healthcare sector here to do something. Or if you are doing something, it would be nice to know. So that's one of the reports that was done. It's actually a discussion draft document that was done with Healthcare Without Harm in collaboration with the WHO. And what this report looked at are examples from around the world on what the healthcare sector is doing. And it focused on 7 areas for mitigation in the healthcare sector. One of the big things that's actually the cross-cutting issue, which is not necessarily there, is procurement. You heard from Andy, because like you heard from the UK, procurement is one of the biggest area where you have the highest carbon footprint. So these are the 7 focus areas of that report: energy conservation and efficiency, green building, alternative energy generation, transportation, food services, waste, and water conservation. So the idea is to make sure to reduce waste, so procure less, reduce waste, address energy saving and energy efficiency in the hospital sector, refurbish buildings, make sure that they are more energy efficient when they're refurbished, deal with transportation, because hospitals do procure and they do use transport in and out of goods, services, and people, as well as staff. waste disposal and management, and water conservation in the healthcare sector. So what I would like to ask here to the audience today is if you have examples of what's happening in your countries. There are more than people here, not only from South Africa, I guess. It would be nice to hear and to share with you these issues of what's happening in the healthcare sector. But I'll focus on energy efficiency and conservation just to show you an example of where the healthcare sector has been saving money and reducing emissions. We have here a hospital in Sweden. It's quite a large hospital. It's a new hospital, and they have what you see here. So what they have done is they've put in 1.3 billion euros, and they're aiming for zero carbon emissions. This is supposed to be for 2015. So we will come back, or we will share with you what has happened then. And they're looking at the construction, the operational material, the energy use, and they're focusing on renewable energy. Okay, we have district heating, cooling by seawater, because in Europe, okay, we've got heating and cooling problems in the healthcare sector. Indoor air quality, which is a very important issue when you're talking about energy efficiency. Half the times indoor air quality is not taken into consideration, and that's a major health issue. And then they're also going to look at what type of construction materials they're using, and the products, and the life cycle, and the procurement, the whole lot. They want to aim for zero carbon emissions. And so far the hospital has been designed to meet some environmental criteria. I guess you might be familiar, we are familiar with the ISO standards. There's the US LED, EU Green Building Code. So this is one extremely innovative hospital which wants to show the way. There are other hospitals in Sweden who are also looking at this and doing food procurement, etc. So we have here another example from the UK. This is part of the National Health Services Trust from, it's based in London. It's the BATS and the London NHC Trust Hospital. It's a large hospital. And those are the number of patients, 8,000 staff. And what happened in 2007, there was a new environmental manager who came in, and in order to meet what Andy just mentioned, the NHS emission reduction target of 80% by 2050, they decided to set their own carbon reduction target by April 2011. So in a matter of 18 months, they managed to reduce carbon by, they invested 1.2 million pounds, and the total annual monetary savings after 18 months was 800K pounds, and the total annual CO2 savings was 5,800 tons of CO2 savings. So this was after 18 months. And so what they've achieved is a reduction of 43% based on the 2007 baseline. So one before last. And here we have an example of from Germany. The Bund is the Friends of Earth, Friends of the Earth Germany. And they have this energy labeling scheme that they established a couple of years ago. So this is the criteria. They offer energy certificate for 5 years for hospitals who meet a certain criteria. CO2 emission reduction of 25% in 5 years, continuous energy reduction, and long-term optimal energy consumption, etc. Now, 31 hospitals are members of this, are part of this energy label in Germany. And there are about 2,000 hospitals. We have a doctor here from Germany, so please do correct me. There are about 2,000 hospitals plus or minus in Germany. Now, these 31 hospitals managed to save this amount of energy, and they also save 55,000 tons of CO2. This is an annual calculation, which is equivalent to 1,400 household usage in Germany. So they saved up to 2 million euros. Up to 2 million euros per year. So I would like to leave you with some messages after those examples. What can we do here in Durban, and what can we do after Durban? We still have the Rio Plus 20. Rio Plus 20 is about much bigger development and sustainable development. So the game is not over yet in Durban. However, we're here, we need to act now, because we cannot keep on waiting. We heard about the health impacts today. So our messages are act now. We need these politicians to act now. We need to be mobilized to input to get the right people to say the right things at the right time, and to get Durban to move. That's what I'm saying. So the sooner action is taken according to the report, the better for health it is. And also huge benefits can be had, and some of the benefits include of better health include promoting productivity. So healthier people are much more productive than sicker people. And we'd also like to see what we heard this morning from the minister as well, including of health benefits and all these models calculating cost and looking at climate change impacts, etc. This is one thing that's still very much missing, and I think we need to place much more emphasis here. Thank you very much.